Hi, today I'm going to be doing a presentation on Down syndrome. Down syndrome is the clinical consequence of having 3 copies of chromosome 21. It is characterized by mild to moderate mental retardation and changes in facial features, including low set ears and a sloping forehead. Characteristics of Down syndrome that are present at birth include a small round head, a small nose with a depressed nasal bridge, a shortened rib cage, protruding tongue, and a transverse palmar crease. It is unknown what causes a fetus to develop the 3rd copy of chromosome 21. But there are certain risk factors that increase the risk of a child developing Down syndrome, such as advanced maternal age over 35 years, advanced paternal age over 55 years, having another child with Down syndrome, or having a sibling of the parent with Down syndrome. It is diagnosed by ultrasound or blood test, amniocentesis, or chronic villus sampling. 1 in every 700 babies in the United States are born with Down syndrome. This equals out to be about 6,000 babies each year. And Down syndrome affects all races and all economic levels. The prognosis for a child with Down syndrome is that it's a lifelong disease with no pharmacological interventions to prevent or treat it. Possible associated defects are heart disease, hip subluxation, patella dislocation, duodenal atresia, tracheoesophageal fistula, and Hirschsprung's disease. Other possible deficits and risks that a person with Down syndrome is at risk for are cognitive impairments, delayed social development, eyesight and hearing deficits, and they are at an increased risk for frequent respiratory infections, leukemia, and thyroid dysfunctions. The goal of care for a person with Down syndrome is for them to live a normal life and to treat any complications that may arise, such as those listed on previous slides. The life expectancy of a person with Down syndrome has risen over the years. In 1910, most did not live to be 10 years old. Today, most can expect to live to age 60 and beyond. This increase is due to advances in healthcare and treatment of other complications. And this age may vary depending on the severity of each person's specific health problems. The teams involved in the care of a person with Down syndrome include a primary care physician, genetic specialist, home health, early school intervention, physical, occupational, and speech therapy, cardiologists, ophthalmologists, audiologists, and a social worker. The primary nursing diagnosis is risk for delayed development related to a genetic disorder. Some interventions for this include to promote bonding between the newborn and parents, educate and support the parents as their child will have mild to moderate delays in development, start speech therapy early, and to see a hearing specialist to see if there are any problems early on. Outcomes would include ongoing healthy relationship between the child and their parents by bonding early on, connecting with a social worker who will help the parents get in touch with the correct agencies to promote a healthy life for their child, and going to the correct specialists to decrease delayed communication. NCLEX question number 1. A newly pregnant patient is asking the risk factors for her child to develop Down syndrome. Select all that apply. 1. Advanced maternal age over 35 years. 2. Drinking alcohol. 3. Advanced paternal age over 55 years. 4. Having another child with Down syndrome. Answer to question number 1. Advanced maternal age is a risk factor. As the maternal age increases, so does the risk of having a child with Down syndrome. 2. Drinking alcohol. At this time, drinking alcohol is not a known risk factor for a child to develop Down syndrome. 3. Advanced paternal age over 55 years. This is a risk factor. As the paternal age increases, so does the risk. 4. Having another child with Down syndrome. This is another risk that increases your chances of having a child with Down syndrome. NCLEX question number 2. Which is not an associated defect of a child with Down syndrome? Duodenal atresia, tracheoesophageal fistula, Hirschsprung's disease, or cleft lip and palate? The cleft lip and palate are not an associated defect with a child who has Down syndrome. Down syndrome is associated with gastrointestinal defects such as duodenal atresia, tracheoesophageal fistula, and Hirschsprung's disease. Thank you for listening and have a great day.